I am Dr. Unnikrishnan AG. I am an endocrinologist and also CEO at the Chalaram Diabetes Institute in Pune, India. It's not correct that type 2 diabetes affects only older people, because type 2 diabetes, a common form of diabetes, can be seen in young people as well, and this is being recognized. Type 1 diabetes, a rarer form of diabetes, said to occur only in children and youngsters. This also has been reported in older people as well. So diabetes can affect people at any age group. Well, it is true that eating a carbohydrate-rich diet, and the important carbohydrate is glucose, can increase the risk of diabetes, but it is not true that eating too much sugar is the reason for diabetes. Well, while eating sugar can worsen diabetes, there are other factors that are very important in diabetes. For example, with genetics and the diet, other dietary aspects, exercise, so many other factors increase the risk of diabetes. People with diabetes can have an occasional sweet. Take it in moderation and compensate by eating less carbs in the next meal or doing more exercise. But the key word here is occasional. Remember, little drops make an ocean, and if the occasional becomes a continuous sweet intake, it's bad. But an occasional sweet in moderation is okay. Well, it's true that people who are overweight are at risk of diabetes, but even thin people or people who have normal body weight also are at risk for diabetes, and people believe that the reason for that is excess abdominal fat, which predisposes people to getting the common type of diabetes, which is type 2 diabetes. Friends, diabetes is a serious chronic disease because uncontrolled blood glucose levels can increase the risk of complications and can cause diseases of the eye, the heart, the kidney, the foot, and also increase the risk of infections like tuberculosis. Friends, while it is true that insulin taken for long periods of time at higher doses does cause some degree of weight gain, that weight gain is not universal, not seen in everybody. In fact, people with diabetes who are taking insulin can follow diet and physical activity appropriately to minimize or even negate that weight gain. Friends, diabetes is not contagious. It is due to a complex interplay of genetics, environment, lifestyle, and several other factors, and it certainly doesn't spread from person to person through contact. So it is not a contagion or a contagious disease. If a person with diabetes controls his or her blood glucose levels, controls their blood pressure, their cholesterol, maintains a normal body weight, there's nearly no difference between a person with diabetes and a person without diabetes. So a person with diabetes can do everything, almost everything a person without diabetes can do, but it's important to follow diet, lifestyle, and the healthcare providers' advice to the T so that you can enjoy all your activities yet preserve your health. Friends, while it's true that if one person in the family has diabetes, there is a risk of another person in the family also having diabetes because it's partly hereditary. It is not true that if you don't have a family member with diabetes, you can't get diabetes because, for example, Indians are at high risk of diabetes. Second, the fact that somebody in the family has to get a disease first. So in today's world, unless you test, you will never know. And do not assume that you don't have diabetes just because somebody in your family doesn't have it. Diabetes is a chronic, serious disease of high blood glucose levels, and medications, diet, and exercise, if started early, can give benefits in the long term. So starting medications late when the complications have begun can only limit the complication. It cannot prevent eye disease, kidney disease, foot disease, or heart disease. So the answer is start diet, exercise, medications early and keep the blood glucose in control early so that you can live a healthy life in the long term. There are many diseases where if you take a pill, your disease gets better and you stop it. For example, if there's a simple bacterial infection. You take an antibacterial drug, you take it, and then the disease gets better, you stop the drug. But diabetes is not like that. It's a chronic, serious disease where a stepwise addition of diet, physical activity, medications is very important, and stopping medications might lead to increase in blood glucose levels. Unless, of course, the blood glucose levels are coming down and your healthcare provider himself or herself will start reducing the medications. So do not stop medications on your own. Well, people with diabetes can eat fruits on occasion and in moderation. Remember, fruits, in addition to sugars, which are of course bad for people with diabetes, also contain fiber, which make you feel full and have a lot of other health benefit. In addition, they also have vitamins, minerals and antioxidants, and overall they are quite nutritious. As long as you keep a watch on your blood glucose levels, a person with diabetes can eat fruits in moderation. Well, missing the medication is not good, but taking double the dosage the next time is worse. Please don't do that, because if you miss some medication, your blood glucose levels are going to increase. But at the next time, if you take double the dose, you can get what is called hypoglycemia, which means high blood sugar doesn't just come down, it comes down to dangerously low levels, leading to sweating, hunger, sweat, palpitation, dizziness, irritability, etc. So it's very important to take the medicine at the time prescribed by a doctor at the right dose. This is very important so that you can control your blood sugars so that it's neither high nor low, and that control will give you a better chance of remaining healthy and well in the long term. That's a very common myth, because treating diabetes is so much beyond a simple blood glucose control. Because in addition to blood glucose control, it's important that people with diabetes control their blood pressure, their cholesterol, maintain an appropriate body weight, and also screen themselves annually for diabetic complications affecting the eye, the kidney, the feet, and the heart. Because diabetes is a silent disease, the person with diabetes may not know that their cholesterol is rising, or their blood pressure is rising, or the glucose is rising, or even if they have a diabetic complication in the early stage, they won't know. So all this is very important, and that means diabetes is a disease affecting the whole body and goes beyond simple sugar control.